Webinar started. Hi, everyone. My name is Kennedy Cole, and I'm the Outreach Coordinator for the Center for Urban and Regional Analysis at The Ohio State University. I'm excited to welcome you to our last webinar in the series, Cities for All, Creating Communities that can be accessed and enjoyed by everyone. This series is co-sponsored by Cura, the Age-Friendly Innovation Center, and the United Way of Central Ohio. Throughout this series, speakers from various fields will discuss how cities can approach urban planning in a way that prioritizes serving the diverse needs of residents. Today, we will hear from leaders in Central Ohio about how they approach age-friendly work within their organizations and provide practical guidance for planners to implement within their communities. Before we start our panel, I want to mention a few logistical items. If you required closed captioning today, you will find a box at the bottom of the screen labeled with CC. Click the box and select Show Subtitles. This will allow you to view subtitles during the panel discussion. During the webinar, feel free to submit questions at any time using the Q&A box. We will ask as many of your questions as we can in the last portion of the panel discussion. If we do not get to your question, apologies in advance. Chat has been disabled, so please use the Q&A if you have any information to share with the event organizers. I do want to mention one thing. We are having a few issues right now with our manual captioning. So we're currently trying to figure that out. But if you do not, uh, if we're not able to get that figured out, we will have automatic captions for you. Also, as you may have seen on our website, this event is approved for one AICP CM credit. To claim your CM credits, log into your My APA account on the APA website and enter the event into your online CM event log. There will be a brief survey at the end of the webinar. If you have time, we encourage you to provide your feedback to improve these events. If you have any additional information following this event, don't hesitate to email cura@osu.edu. To learn more about Cura's future events or sign up for our monthly newsletter, visit cura.osu.edu. You can learn more about the Age-Friendly Innovation Center at agefriendly.osu.edu and the United Way of Central Ohio at liveunitedcentralohio.org. Now, I'd like to turn things over to Marissa Sheldon, Director of the Age-Friendly Innovation Center, who will lead today's panel discussion.
Thank you so much, Kennedy, and to
Yeah.
Kira and the United Way for the opportunity to be here today. Kenny is going to share some slides while I do a framing before we get into our conversation. Let her pull those up. Let me know, Kennedy, if you are having issues with the slides. We'll go ahead and get us started, keep us on track timing wise. As many folks in this room probably know, across the world, we are being presented with the opportunity to reimagine our communities as we have a larger number of older adults than we've ever had before. This is a trend that is not changing. While the baby boomers are leading this demographic shift, thank you for the slides. The next and subsequent generations are just as large. Recognizing this shift in our new normal, the World Health Organization, if you could go back to that previous one, the World Health Organization created the Age-Friendly Communities Network, which provides a framework for cities, towns, counties, states, truly communities of any size to adopt, committing to an ongoing cycle of improvement that centers the voices and lived experiences of our older residents. Through the leadership of your highest ranking elected official, mayor, council, city council member, commissioner, or governor, you embark on a cycle that restarts every 5 years, assessing your community, planning based on those learnings, and implementing the strategies you've identified. Each step, the assessment, planning, and implementation are done through the lens of the 8 domains that you see on your screen. Today, we're going to talk about some of the strategies we've moved forward across Central Ohio. Through the leadership of the Columbus Mayor and Columbus City Council, Columbus was the 60th U.S. community to join the network in 2016. And since that time, well over 1,000 communities in the U.S. have joined and nearly 2,000 across the globe. Next slide, please. The work we do locally sits at the intersection of community need. What are the older adults telling us are the challenges and opportunities to improve our communities? What is the best available evidence? What does the existing research tell us are the best ways to approach that challenge? And what do we actually have the capacity and funding to accomplish? As you can imagine, the lens of the 8 domains is so broad and looking at so many aspects of what it means to age in community that there could be no end to this work. A pioneer in the age-friendly communities movement, Kathy Black said once that this work is a mile deep and a mile wide. Capacity and funding has to be a critical step in prioritizing the work, and we're excited that some of the things we'll talk about today are some of those items that don't take tons of funding and capacity. Our work is also grounded in the quote you see on your screen. When you give input, you want to see change. This is from Daniel Sinclair, an original member of our resident council here in Columbus, who has guided our work for many years. And it really keeps us centered that we should only be asking older adults to share their voice and their experience and wisdom if we are also willing to ensure that it leads to meaningful change. A key learning here locally for us has been the value of strategies that are not just cross systems, but intentionally moving the work forward in a mix of programmatic, policy, and research initiatives. We know that our simple problems in our community have already been solved, and we are left with those big, challenging ones. For example, communities across the US are grappling with what it means to have more older adults experiencing homelessness than ever before. Here in Central Ohio, older adults represent the largest group of those entering our shelter system and experiencing homelessness. The solutions to such a big challenge cannot simply be change one zoning policy or invest in emergency rental support. It has to be bigger and broader than that. We know we need policy change, programmatic support, and we need to be doing research because we don't actually know the best interventions to support this group in this emerging issue. Simply put, we need to walk and chew gum at the same time. We cannot simply approach this work through one lens. And I'm excited to introduce our panel who will talk about those strategies with us today. Next slide. I'm joined today by three local leaders. First, Michael Stinziano, the Franklin County Auditor who took office on March 11th, 2019. For the last 7 years as the County Auditor, he has brought a broad range of innovations to the office using the guideposts of connect, protect, and reassess. Prior to his role as the Auditor, Michael served as the Director of the Board of Elections, as a representative in the Ohio General Assembly, and as a City Council person. We are also joined by Dr. Holly DeBelco-Shoney. Dr. DeBelco-Shoney is a community engaged social work scholar and educator committed to improving the lives of older adults and family caregivers through community-based interventions identified and developed alongside older persons, practitioners, students, and faculty. She is the director of research at the Age Friendly Innovation Center and strives to improve the social service and built environment that support the inclusion of older adults. And finally, Katie White, who serves as the executive director of the Central Ohio Area Agency on Aging, where she leads the execution of federal, state, and local programs for older adults and people with disabilities across an 8-county region. She has worked in the nonprofit, government, and university space while also serving on numerous boards to add the aging lens across public and private sectors. With a dedication to grassroots inclusive planning, Katie has had a successful career that included her time founding the Age Friendly Innovation Center, being the founding director of the Village Connections, a local nonprofit serving older adults, and a strategic leader at the Alzheimer's Association and a valued team member among home and community-based services organizations. Thank you so much all for being here today. Kenny, if you want to pull down the slides, we will start our panel conversation. Thank you. I'm going to start with a question for you, Director White. Knowing that a lot of the folks who are joining us today are coming from a planning background, they might not be familiar with the area agency model or the Older Americans Act. Can you share more about that network and the type of programs that you all provide here locally?
Definitely. And thank you so much for having me here today. Excited to chat with Dr. DeBelco-Shoney and Auditor Cinziano and you about this topic. So area agencies on aging are a lot like metropolitan planning organizations or regional planning commissions, as I assume many people are planners on the call and would know those terms, except we are on the aging and disability side of that. So we take in the federal funds, which are mandated to come to states through the Older Americans Act at the federal level. We disperse those funds across our regions that we serve based on a formula of how many older adults, and some other metrics. And those funds go directly to service providers that are providing things like Meals on Wheels, home health aides, transportation services, things of that nature. Every U.S. citizen is served by an area agency on aging, and we all serve various sizes. COAAA, as we call ourselves in Central Ohio, serves 8 counties. So Franklin County, the 7 contiguous, as well as Fayette County. In Ohio, we're a little bit unique as area agencies on aging because we provide in-home case management for individuals that would otherwise need a nursing home level of care, but who are waiving that right or opting to receive their services in their home. So COAAA's folks go out into individuals' homes who qualify for that level of need at a nursing home and who are also on Medicaid. We assess their needs. We coordinate those services for them. We provide ongoing case management to make sure that we're continuing to meet their needs. And then on the other side of the shop, we also have a team that monitors any of the providers providing those services to make sure that they're following regulations and providing really quality care. So for all intents and purposes, we are sort of a one-stop shop. If you've got questions, if you're looking for education, if you are qualified for any of our services, we're serving roughly around 12,000 individuals on any given day through our case management services. And in 2025, completed over 49,000 home visits. So we're a staff of about 400 individuals, most of whom are registered nurses and licensed social workers. And we are really the boots on the ground. We're the advocates and the kind of eyes and ears of folks making sure that they're getting what they need.
So helpful, Katie. And I'll put you on the spot to share that you recently, semi-recently, in the last couple of years, hired the very first planner at COAAA. And knowing it's a room full of planners, do you mind sharing a little bit about why that was such a valuable role within the organization and a bit about what that role looks like?
Sure. So there has been a planning role in the past, and I believe Dr. Belko-Shoney actually held that role. But an official
Sorry.
individual graduate from Ohio State University's master's in regional planning, yes. So we implemented this position, I think 2 years ago after hosting a planning intern. So each individual getting a planning degree has to have a placement. And so we just really saw such a value in that profession and actually linked our only planner in our social service agency up with the only social worker at our Mid-Ohio Regional Planning Commission because we sort of realized we're two sides of the same coin and looking at bringing in federal funds and making sure we're meeting whether it's the infrastructure on MORPC side of things or aging disability services on our side of things. So it's been a real value add. I think a few other area agencies have planners, but absolutely recommend it if you're interested in aging or disability services at all. The local AAA is a great place to work.
Thank you. And thank you for correcting me. Holly, I know your bio well, but apparently I forgot that title.
It's a gentle correction. Sorry about that.
Auditor Cinciano, when we listen to your bio, it is clear you have held elected positions that range city, county, state, and would love for you to share a little bit about how each of those different roles you've tried to add this aging lens and really think about older residents and the policy agendas you have.
So I really appreciate the opportunity to participate and provide that perspective. So yeah, been busy the last decade or so. Can't My wife will tell you there's not an election I don't like apparently. But having had the opportunity to both serve, starting at the State House, where some of our strongest advocates were older adults. They had the history, they had the knowledge, and they vote. And so they really were engaged, understanding how important it was to build those relationships with your elected officials and then advocate for your needs. And what is good for an older adult's good for the entire community was kind of an early sentiment that really resonated with me. And so a number of policies pursued were guided by that. Good or bad, though, I was always in the legislative minority. So when there's the opportunity to then go to a legislative majority at Columbus City Council, went down the street and had the opportunity. And that really was when the rubber met the road in terms of how can we make sure every policy we're looking at has an older adult lens contributing to it. For the city of Columbus, 14th largest city, we're adding population. We're a little counter to what we've been seeing in terms of economic growth, housing, compared to the rest of the state of Ohio. And so along with my colleagues, really leaning in and reiterating that not just being an age-friendly community, but age-friendly policies. And so as we are voting on things, as we're pursuing initiatives, how are we making sure that older residents' viewpoint, accessibility, needs are being incorporated into those policies? It's a challenge. It is definitely a little bit of a transformational shift, particularly because council at the time trended younger. We did get some more seasoned members later on, but just trying to continue to remind folks good policy, but are we making sure it's what's best for every resident, not just for a few? And then on the countywide, county auditor is a little bit of a different beast. It's a statutory created structure. For other folks, it's probably best known as the chief assessor, but I also issue dog licenses. And so trying to make the office accessible and in that assessment role, really hearing from folks concerned about how current Ohio law is impacting their ability to age in the neighborhood or community that they want to. And so while Ohio has a homestead exemption, it's not meeting the need of the growing population. While we have, again, growth in neighborhoods, the way the law interacts and establishes property taxes has a lot of older adults at their kitchen table concerned, am I going to be property taxed out of my home? And so working with those older residents, advocating now back to former colleagues at the State House, but continuing to understand that, when we get a call or a need at the county level, those folks are reaching out because maybe they don't know where to go, or maybe they just need help in understanding what the law is and where we can advocate for. And so it really has been the challenge of listening and then incorporating all that feedback into the policies at any state, city, or county level.
Thank you. I appreciate that and the transparency about a group of young elected officials trying to really reshape that narrative. We joke at our center lovingly that aging is so cool, we're all doing it because literally we're all getting older every day. And if we are planning our communities with the lens that we're doing what's best for older adults, that will hopefully benefit us all in the future, benefit our children, benefit our loved ones. I know I've heard you say, Holly, everyone loves someone that's older than them. Hopefully we all have that opportunity and hopefully we all have that pleasure of growing older. So I just appreciate, sometimes we think of ourselves in the policies that we're working to enact in those roles, but really we should be thinking about our future selves as well. Appreciate that. Dr. DeBelko-Shoney, some of your research has focused on emerging issues within the age-friendly communities framework. We looked at those 8 domains, and while it is really comprehensive, there are things missing. And so I'd love for you to share a little bit about this idea of what it means to be a climate resilient community, thinking about older adults. And why we need to think about older adults when we think about there being more extreme weather than ever before, and why we should be doing research in this space.
Yeah, thank you so much. I appreciate the opportunity to be here and to talk with all of you. I have to giggle. Director White, thanks for the shout out. I did work on the area plan. It's been over 25 years ago now. So I give Director Sheldon the the pass that was quite something certainly in my past. So yeah, so we are experiencing in our communities 2 different phenomenon that are happening. Our communities are aging, and our world is warming. And what that warming world means is that we are experiencing more frequent and extreme weather events. What has happened in the past, which is what we often model our planning programs and policies after, is those past experiences with precipitation and flooding, extreme heat, are not good predictors of the future. So we know that our future in a warming world is going to be different. And so we are experiencing an increase in the number of older adults and an increase in the frequency and severity of extreme weather. And as we think about the different domains of age friendliness that we care about, housing, transportation, social engagement, employment, volunteerism, services, supports, all of those systems and structures are being impacted by our aging communities and our warmer communities. Um, as my colleagues have mentioned, the importance of keeping that older adult lens as we consider planning programs and policies. Unfortunately, we still, and I'm going to say all of us, because this includes all of us who work in this space, are still impacted by age-based biases. So we tend to focus first on families and children, and we don't always include those realities of life changes that are more likely to occur as we age. And so we see that in our systems as well. So, for instance, recent research project that we did in collaboration with the COAAA and the City of Columbus was to look at issues of emergency preparedness and coping in affordable housing properties for older adults. These affordable housing properties have no requirements for any kind of emergency planning. So we're looking at low income, um, uh, shared housing situations, so apartment type housing situations, high density of older adults, often who have faced accumulative disadvantages, have fewer social connections, which we know is a really important protector of the way we face any type of crisis, whether that's extreme weather events or not. Um, and so those folks, there are no requirements from HUD or others to have emergency preparedness plans. So through the support of COAAA and the City of Columbus, my colleague, Dr. Smitha Rao, and I began to talk with residents of these affordable housing properties about their experiencing managing things like extreme heat, extreme participation, tornadoes. Ohio in the past was viewed as a safe haven for tornadoes. That is no longer the case. We experienced more tornadoes than any other states last year in the US. And so, part of answering these questions, how can we best prepare and respond, is to hear directly from what we call the experience experts. Many of our policies and programs have been designed without understanding the lived experiences of the individuals who are most impacted by these policies. And so this work has taken the best scientific evidence available around preparing for emergency extreme weathers and combined that with the actual lived experiences of older residents. For instance, many of us grew up doing tornado drills in school where we got on our hands and knees and covered our heads. As you can imagine, with a group of older adults, many of which who are experiencing disabilities, they laughed at us when we talked about that is considered the safest position to be in. They couldn't get down and could never get up. So, in addition to that, we're often told, keep all your emergency documents on a flash drive. That may not be feasible for many of the populations that are at highest risk of death and other issues due to these events. So we take the experience experts, the scientific evidence, and create resources. So we recently created a toolkit based on this research for service coordinators, those human service professionals who work in affordable housing, along with videos to help prepare and respond, not if, but when these extreme weather events occur.
Thank you. I so appreciate that. And I feel like every time I have the opportunity to share about the warm work, it is on the tail of an extreme weather event. We had a very unexpected hailstorm this week here in Central Ohio. And I have to imagine, Auditor Cinziano, that is changing your week as well, knowing that impacts property values and insurance claims and all the pieces and parts of what it means to own a home and want to age in that when there's more extreme weather. Um, we've talked a little bit about housing in different capacities in my introduction. I talked a little bit about this increasing number of older adults experiencing homelessness. We heard from the auditor around the property tax piece. There's lots and lots of conversations happening around what it means to be an older renter and experiencing such extreme housing cost burden. We know that that's something happening across the US. So I'm curious from each of your perspectives, when you think about the local work that's happening to support older adults' ability to age in their homes, what might be possible for communities across the country to learn from us as they're thinking about how this might be presenting in their own community?
I mean, I'll go first. I'm not sure you
Please.
want to follow Ohio law. One of the worst headlines I ever had is Ohio is a hard place to grow old in, because we don't have a modernized homestead exemption. We are relying on statutes that created and established an over reliance on property tax to fund services. And when it comes for older adults, I mean, they've been in these neighborhoods 3, 4, 5 decades, and they are paying more now in property taxes than they did when they ever had their mortgage. And so, it continues to be a big push to advocate to the General Assembly to find solutions, particularly for older adults. While we do have a homestead exemption, the way it has evolved over time, our population is getting older and less are getting the benefit because the economic component to it is so low. And so, I mean, I think the lesson learned is have a great homestead exemption. I think another lesson learned is the diversity in housing stock. Maybe it's not the home, but it's certainly the community or neighborhood you want to grow old in. It's what you're familiar with. And while we are trying to address a growing population in Central Ohio and Columbus in particular, one level homes almost unheard of. Even in the focus on making it livable with grab bars or lack of stairs when they're not needed continues to be an evolution where I think a lot of folks are looking at, well, what does the market say? That's what the builders are going to build. Well, we are decades behind in terms of the stock of housing and in terms of the housing we need to meet the need, while our community and populations continue to get older. And so it's just been a real challenge to point out those challenges over and over and over again, see a little incremental approach. And I think being an age-friendly city and county is helping, but we started off a lap behind and are still playing catch up.
I appreciate that. Okay, so when you get to make all the rules, what's your magic wand response? What would be that change you would make to resolve the problems?
I mean, for Ohio and Homestead, I think we would freeze potentially property taxes or eliminate the property taxes for those that are qualifying. The challenge that we always hear is, not everyone should get it. I'm not sure why. Why not? But that, again, particularly older adults, they've won the race, they've invested, they've made these commitments. They're going to rely on those services that they have committed to before, but we've still got to find a better solution so they feel they're receiving the benefit of the community that others are getting as well.
Thank you.
Can I add? Okay. Sorry, I feel like I'm on a tiny bit of delay, so just making sure. So if I think about some things that we are doing really well here that may or may not be the case in other areas of the US. So thinking about baseline things that I think are standard, property tax exemptions, different rules around that, because Older Americans Act support some home modifications. Hopefully, everybody's got that. Rental assistance is something that's becoming more and more common, for better or for worse. We're rising to the occasion as AAAs to make sure we're doing that. I would say that trying innovative solutions, I think maybe we'll get into it in a little bit, but we piloted something here called a shallow subsidy, where we provided a modest amount of rental assistance over the course of the year and worked with the Age-Friendly Innovation Center to evaluate those impacts. But furthermore, when I think about the audience of this panel, I really think what we're getting right in Central Ohio is this collaboration and inclusive planning that I think we do a really good job of coming together. So, metropolitan planning organizations, regional planning commissions, a lot of government agencies are forever doing different plans, whether it's water resource management or a housing plan or transportation plan. In Central Ohio, we've got a pretty good history and reputation since launching Age Friendly, and a little bit before that too, of making sure that we're coming at these plans together. Because if you want to make sure, to everyone's point, that everyone can, age in their community, we need to make sure we've got those voices. So looking at hosting focus groups or planning sessions together, right? So if we've got a transportation group that's doing a plan, partnering together to make sure, is it hosted in a place that's actually accessible? Is it near a bus line? Are there steps to get in? Are there accessible bathrooms? Like, are we really being intentional about working together to include that aging and disability lens, not only on the planning processes, but then also working together when you create those plans to make sure that really all of us are rising together.
Yeah, I'd love to tap onto my colleagues' comments. I think the importance of thinking about these issues across sectors are critical. And so, for instance, as we think about housing, we need to think about this whole continuum of different types of housing, from home ownership to rental, to multifamily. We have to think about interventions and opportunities to build housing stock to respond to immediate needs across a whole continuum. And we need to ensure that we are thinking about cross-sector benefits. So as we look at housing interventions, in the goal, supporting individuals in living in safe, affordable, accessible housing. By doing that, are we having an impact on high-end healthcare cost utilizations? Are we reducing EMS trips because we are having these housing stability and approaches? So really getting out of our silos, and that's what the age-friendly framework is so good at, is looking at these issues in an intersectional way. So as we look at what difference are we trying to make with these interventions around housing, what are those changes or benefits that occur in these other sectors? I think the other challenge for us as we run to catch up is to figure out which individuals benefit the most from what kind of intervention. So, stepping away from just throwing, these are the current levers that are out there that we can pull. Let's hope good things come from those in terms of our desired outcomes. Instead, to be thinking about giving those rental subsidies to those individuals who are in the best position possible to continue living in the home that they're living in. And at the same time, as we look at this continuum, in particular around housing, we have to recognize that housing interventions for older adults, many of which live on fixed incomes, face significant discrimination in the workforce. So even if they want to work, they may not be able to find jobs for a variety of reasons. So as we think about housing interventions, they're different for younger people than older people because there are more options around income and accessing resources. So one size doesn't fit all here. And it's important, I think, to recognize that and have a multi-pronged approach.
I so appreciate that. And while you didn't use the words, I'm sitting here thinking about those social determinants of health and how, housing is healthcare, transportation is healthcare. All of these pieces and parts of our community that can be impacted by policies and by programs are really central to what it means to age well and to age in the healthiest possible way. And we can't disconnect one from the other. You also said this, Katie, and I think about conversations that I have with folks around the country around what our age-friendly work looks like here locally. And while the auditor did mention that we are property tax heavy, we are grateful for some of those all of those property taxes and the programs they create. But in particular, thinking about here in Ohio, we have, Katie, correct me on my numbers, 70 of our 88 counties that have a aging specific levy these days.
Sounds close.
About 70 of our
Exactly.
88 counties. And the Older Americans Act and the dollars that come through our AAAs are phenomenal and an important resource in every community across the US. You know, every American is covered by an area agency, and that is foundational to supporting what it means in aging. And many of the programs that are happening in our area agencies have very low income thresholds. You have to be Medicaid eligible. And so our property tax levies are built to support folks beyond that number, meaning that oh, please, Katie, yeah.
I was just going to also add that our Older Americans Act funding has essentially been flat for decades. And so the property tax or other tax levies become even more important as the need increases and the severity increases. If the Older Americans Act is kind of the baseline and that's staying even, then we need even additional local dollars to match what we're able to do.
Yeah, no, I so appreciate that. And stagnant in its number while the number of older adults rises so significantly. And, you know, we're very lucky. It doesn't solve all of our challenges, but I think I'm grateful for those who had the wisdom decades before me to get these property tax levies, mostly property tax. I think Union County is the only sales tax set up in our older adult levy system. But really grateful to have that infusion of support and programs across our state. And I think that's a really critical thing that sets apart aging in Ohio. And I'm going to have to disagree with that headline. Auditor, Ohio is not the worst place to age.
Didn't say the worst,
Nope.
difficult place.
Difficult. This is true. So in my introduction, I also talked about this important piece of the work that I think there is no one immune from these days, capacity and funding. Every community across the US is thinking about what it means to function on a tighter budget, a smaller budget, and make difficult choices. And what I love about the age-friendly space and some of the conversations we're having today is that not all of it takes a ton of investment. Not all of it takes a lot of capacity. And so I'm curious from you all, what are those kind of like low-hanging fruit changes? What are those policy considerations? What are those things that can happen that don't take tons of investment that you think folks on the call could learn from today?
I don't know if they want me to go first. I actually think Director White hit a little bit on the head. It's that focus group piece. In the auditor's office, for example, we put out tons of mailers and notifications. And if we don't bring an older adult focus group, they're the first ones to call and say, I'm confused. What does this mean? And causing any consternation and not being able to be clear, concise, and educative in those notifications is a failure of our team. And so making sure those older residents are a group of folks that really have the understanding of this is who's really going to receive this is key. And so we have found the more we're able to utilize focus groups in a variety of the functions that we're engaging in goes a long way to saving both confusion, but on the back end, additional work and explanation as well. And then the other one I was going to plug at one point, which I think those in Central Ohio on this call know, we had a property tax assistance program. And it was able to be targeted to some of the other comments, relief for folks that are finding, you know, a change in household circumstances or loss of employment or economic challenges. But it was a one-time opportunity for qualifying applicants to kind of bridge so they could plan, get to that next property tax bill, not feel, oh, I'm being property taxed out of my home. Bureaucrats being bureaucrats, unfortunately, took that away from us. I still think that is low-hanging fruit. And so we are continuing to advocate for explicit authority in Franklin County to be able to provide a property tax assistance program where, for those that aren't familiar, it wasn't explicit. So they said, well, because it's not spelled out in code and your office is a creature statute, we are going to not let you do that anymore, even though it had existed for multiple decades. Two low-hanging fruits from my viewpoint.
Yes, I mean, you stole a little bit of my thunder, but I'm just going to add to it. So I would say a low-hanging fruit, sort of a challenge for planners, no matter where you are, if you're working on a plan, if you're working on a report, I would challenge you to have some kind of aging and disability inclusive lens that you're always making sure you're looking through on everything that you do. And a couple of like quick things that I just jotted down as we were thinking about this. If you're talking about development and you're talking about density, there's really important factors that you should hear from older adults for example, fire truck ladders don't go over 7 stories. And so if you build higher than 7 stories and you're going to have a group of individuals that's likely to have disabilities, you're going to need to have some kind of plan around if the power goes out and they need to get out, because that does happen. If you are in watershed or water resource management planning, you need to have older adults and people with disabilities in that conversation to understand what they need in terms of home modifications or where that water flows, or if it's not, well taken care of, what that might mean in terms of an additional expense for someone that's on a fixed income and now they can't fix it and now they've lost their housing because of, their gutters or something like that, and water resource management. And another example, climate resiliency or environmental justice, right? If you're working on those reports, those are even easier to add, or more important, I guess, to say, that inclusive aging and disability lens. But to Holly's point earlier, we are experiencing more weather emergencies, and individuals that are older or have chronic conditions or disabilities are disproportionately impacted. So if you think about someone who's diabetic and their medication that they chose to purchase for the month, instead of being able to buy, the full groceries that they might have needed, is in the refrigerator, and you lose power and you've lost all that medication and all that money. Or if you're on oxygen and your power goes out, right? So really challenging you, find your local area agency on aging, or if your community is age friendly, and just bring them into each of those conversations. They'll be partners to you and making sure that your plans are inclusive. And if you were going to hand me the magic wand from Auditor Cinziano for a second, I would also say, throw some money at your area agency on aging or your age-friendly community for doing that, for bringing the folks together, because they're also going to make sure that those residents are reimbursed for their time and expertise.
So appreciate it. And yeah, please, Sally. Thank you.
Oh, yeah. Just to dovetail off from my colleague, so the importance of having space and listening to folks so that the actual plans and programs and policies that you put forward reflect their real lives. Um, Also, I think it's important, a low-hanging fruit is even just building your own knowledge about normative parts of aging. So we're not just talking about individuals who may need a wheelchair or mobility device. We're talking about normal sensory changes. As we age, we experience vision changes. That they're not diseased eyes. It's part of normal aging. So, what do your materials look like? Are they accessible for normal aging eyes? Hearing, I happen to wear hearing aids. Um, at 55, we always like to age drop in the work that we do, proudly. So when you're holding those focus groups, do you have a microphone? Is it in a space where people can hear and can contribute? So part of it is the inclusion, the invitation to listen, and to listen, to hear, to understand, and to provide those opportunities. And the other piece is coming in with knowledge and understanding about effective ways to communicate and collect information not just from people who you may be able to see physically their disabilities, or if they have had some type of life event or an aging related disease or condition, but just natural parts of aging that we don't always recognize. So having a little checklist for every focus group you run, every community experience, community meeting you have, any type of publication that goes out, ensuring that you are using best practices that make the opportunity for people to access information, to provide feedback fully in a meaningful way. We conduct walk audits, we conduct event audits to help folks make sure that we're thinking about how individuals can fully participate. So an invitation is not enough. You have to go beyond that. In the Q&A, one of the questions that came up was about food and food access and the implications around um, income and assets. And absolutely true. So we're putting a lot of things online. We're expecting folks to understand and utilize digital work. Now be careful. Don't fall into the trap of assuming that older adults are not digitally literate. That is not true. What we know is it's income based. Social economic status is what really matters the most in terms of accessing. So if you're sharing plans, if you're sharing meetings in an online environment only, you are missing out on those folks who could perhaps make sure that your plans are in the position to be more successful because their voices and insights are added.
Can I add one more too? And Marisa, I'm going to set you up and then you just, take this one home. But talking about avoiding ageist and ableist language, if you want to share a little bit about that too, that's free and easy and you can start today.
Yeah, I so appreciate that and all of the comments around some of those things folks can try and do today. And that's such an easy one from a lens of a planner or someone working in local government is to be mindful and thoughtful about the language you're using. We know that language matters. And when we talk to older adults about what that language is, the preference is older adult. It is not senior, it is not elderly, and it is a space of increasing respect in the way we talk about folks. And often, if you don't know, you can just ask. How would you like to be described? What is that? What if it is just folks over the age of, and you define how you're focusing that plan, that strategy, that policy to anyone over the age of 50 or anyone over the age of 60. I think about there was a city council person in Toledo, Ohio, that we learned from years ago that added in a specific framework that any policy within their community had to go through to ensure that it was not excluding the disability community. That is a free and easy thing, easy in some regards, to adopt in your community. If you think you have that buy-in to ensure that today and in the future, all of those considerations from language, from access, from all of that. And I'm also thinking when you were talking, Katie, a little bit about some of those pieces of supporting folks living in that shared space and another opportunity that feels pretty easy and simple. Do you mind sharing about your conversations with AEP and buildings that do or do not have generators when there's power outages? I see you thinking.
Sorry, took me a second to catch up to where
Yeah.
you were. Yeah, absolutely. Another, sort of easy thing to do is work with your local energy company. Locally, we were able to have conversations to map out where the grids were with our low-income housing complexes. That way, if they have to do a proactive shutdown of the grids to conserve energy or a brownout, I think it's called a brownout, that they take in and keep in mind which ones are low income high rises that do not have generators, a la making sure that people can get out of the building and they're not closing down the buildings that folks wouldn't have a way to get out of.
That's great. And I'm not sure, Kennedy, if there's follow-up after this, but in the last year, Medicaid actually released a mapping tool that goes down to the county level to show where there are folks that receive Medicaid, that are on Medicaid and have durable medical equipment that would be at risk during a power outage. So you can really think and look about that data that's out there. And Holly, I appreciate you noting the question in the chat, and you responded to some of it, but I'd love to ask the whole group, where do you see the intersection of wealth in this discussion? And this is something that's really top of mind for us at the Age-Friendly Innovation Center. The age-friendly framework has been criticized for being for the healthy, wealthy white, prioritizing and creating strategies that are supporting those that already have means. And I think locally we've done work to try to make sure that we are listening across that spectrum, not just to those that have the means. And I would love to hear from each of you how you think in your work you're ensuring you're hearing the voices of folks across that entire spectrum, or how that's showing up for you.
I'll kick off this one. I think mine might be the shortest answer just because the nature of the work that we're doing, we are primarily serving individuals that are low income. And so we make sure that our staff are very well trained in motivational interviewing and trauma-informed care. We work in various languages, so we're really trying to make sure, just from a interactive point, being in someone's home and asking them somewhat invasive questions that are required, that we have all of those lenses that we're making sure we're really sensitive to.
Yeah, I think this is a critical question and something that we grapple with a lot and think about how can we influence and influence beyond providing the statistics and the data. A strategy that we have been implementing as both an awareness raising tool as well as a data collection tool is doing some scenario planning. So we have brought together older adults, we've brought together practitioners, public elected officials, program officials to actually sit down and talk about a particular case, whether that's around transportation, an individual who has a need to get to a particular location, whether there is an extreme weather event that requires evacuation. And we include in those cases specific examples that are real in our community and are experienced. And so it's a way of perspective taking that is very different from simply providing those statistics about some of the realities of our residents who are living with in low income with low income. And so that has been one strategy that we have been using for both research purposes and also perspective taking purposes to raise those very issues that you raise in your question.
That's wonderful. I saw that. Oh, were you gonna add?
It's a point of frustration for a countywide office holder. I and the members of the office are astutely aware that the individuals that engage in the services, opportunities we provide aren't reflective of the entire county. The diversity, the social economic, just, and it continues to be a riddle we haven't been able to solve. Very intentional to try and solve it, but be that it is a very bureaucratic office, it's county office, so folks don't always know what it is we do or don't do until they're impacted. Continues to be a challenge, but it is something in terms of leaning in, being intentional, and trying to solve that riddle. We have as a North Star every day.
Appreciate that. There was someone who asked about that mapping, so I'm hoping folks can see in the Q&A that I dropped that in. If not, we'll make sure it can get to you. And I said county level, but it actually goes to zip code level. So I apologize. It's even more granular than that. So
Marisa,
appreciate
there's
it.
another question in the chat too that I actually think is probably really well poised for you in the webinar chat. Do you want me to read it?
Sure.
What are the most important things that an older adult should look for in a neighborhood to live and thrive independently as long as possible?
That's a big one. I love that question, and will say there's a lot that you can be looking for, and it's so individual. You want to think about a home that you can age in. You want to think about a community that if you can no longer drive or no longer want to drive, that you can move around, get the places you want and need to go. That proximity, that walkability. Those things are really critical. I'd welcome other thoughts from folks. Yeah.
Yeah. The other thing I would add, yeah, walkability, hopefully access to transit. I also think another really easy one to forget, and I know I'm probably stealing this from Dr. DeBelco-Shoney, though, is a place where you can have social connections. We know that social connections are a really important risk mitigating factor in aging, making sure that you have someone to call, or that someone could call you. That's another really critical piece when you're thinking about where you might be able to, as the question said, live and thrive independently as long as possible.
Yeah, I think the other thing I would add is that many of those factors are the same factors that everyone needs. I think a really interesting model for those of you who are from Central Ohio is Bridge Park in Dublin is a very interesting model because they are seeing, and again, high wealth. So we need to acknowledge that right out the gate. But the folks who are living around Bridge Park are older adults and young adults. And it is the walkability, the transportation, access to bars and restaurants, access to library, to pharmacy, all of those, and then the density. So the social connections is another piece. So there are issues there as well. But the point that I want to make is really that many of the things that we think about that we want as we age are also the same things that people of younger ages um, want and need because you might blow out your knee playing soccer and no longer be able to get up your stairs to your bathroom when you're doing your co-ed soccer team at whatever age. So thinking about those things I think are really really important at all ages.
We are nearing our time, and I apologize. We're not going to get to all the questions in the chat. Please do not hesitate to reach out to us. I think Kennedy shared agefriendly.osu.edu, agefriendly@osu.edu is our email, and can connect you with any of the panelists. I'm going to pick one that I think folks would be able to do quick justice to. So talked about this lack of accessible housing stock. What are those high priority policies, and I'm going to add in programs too, that are needed to address this gap?
I'm not sure that's a quick one, but
Oh,
I mean, one thing we often hear
uh-oh.
about is just the bureaucracy. It is more expensive in Central Ohio to build a home because of some of the paperwork and qualifications. So, trying to streamline. We've also taken on in Central Ohio a rezoning component. So, trying to allow for higher and more density to occur. That does have some not in my backyard components. That does have some impact. If I've been in this neighborhood, you're trying to change that neighborhood. But I will keep it short there. But I could go on. I could do a whole hour on that.
I don't know, Katie or Holly, if you would want to speak to this more, but I think also about investing in programs that support modifying the current homes we have. While we do have some of that, we don't have a ton. And we know that older adults and all of us want to age in our homes primarily. And so if that just means investing in a ramp or grab bars and actually being able to pay the folks to do that safely and appropriately install those things, that's a big missing piece of that puzzle too.
Yeah, I would say like an umbrella for that policy is keep people housed, prevent, prevent, prevent. Whatever we need to do to keep people where they are, if that's the safest place, obviously, is the best thing to do. And I also popped in an answer to another
Oh, thank
question
you.
about what cities are getting it right, essentially. So I put in the livability index where people could put
Thank
in their zip
you.
code and get a score on that.
If folks are interested in learning more about the H-Friendly model, H-Friendly Innovation Center does have online courses that can be accessed to understand how you join, what that looks like, how you move this work forward. But just want to say thank you to our panelists, and I'll pass it back to Kennedy to close us out.
Thank you. And thank you so much to the panelists for the informative and enlightening conversation. Again, I'm sorry that we were able to go through all the questions, but please, as was noted earlier, reach out and we will make sure it gets to the right person. So I just want to do a little housekeeping before we end the webinar. Our next webinar will be the first in our new summer series, From GIS to GeoAI, Bridging the Gap in Geospatial Education. In the series, presenters will share their experiences teaching GeoAI to the next generation of geospatial professionals and discuss what it means to be AI fluent in the context of geographic information science. The first event will take place on Friday, May 15th from 12 to 1 p.m. Dr. Wei Lin from the Department of Geography and Geographic Information Science at the University of Illinois, Urbana-Champaign will speak on GeoAI and the human geography, data, algorithms, and critical features. We hope to see you there, and thank you all for joining us today and have a good weekend. All right.